guys, Larissa here with your labor nurse. Excited to be bringing some new content for you today. I'm going to be talking through the triage process. I don't know if every hospital calls it the triage process, that's what the ED calls it. Some hospitals have a separate mother-baby unit that patients can actually come to be triaged. More or less, triage means you come in and the nurse works with the doctor to be able to see what's happening. What can we diagnose you, or what can they diagnose you as? What can we see what baby's doing? How far are you? And basically we get a general history and then we see what's happening. And then from there, basically the options are you go home, we don't do anything, we tell you everything's okay, and we're just confirming that everything's good. Another option is you are treated with something. So you're given a medication, you're monitored for a little bit while longer, or something like that. Another option is you could become an outpatient. So you could be under observation and you could stay and maybe have some fluids going and baby monitored until morning. Again, just depends. Or you're admitted, so you become an inpatient and you stay in the hospital. Depends on your circumstances, but I just want to give you an idea of what triage looks like and what a nurse is looking for in the communication from there. So if you're at a teaching hospital, that's going to look a little bit different because you have OB staff there, or residents per se, that are helping make those decisions or are part of the triage process. A lot of hospitals do have a 24-hour OB that's there, but isn't called until after the nurse does that initial assessment. So you walk onto a triage unit, regardless if that's like an ED or an actual triage on a mother-baby floor. Most of the time you're going to be placed on a monitor. You can check out my NST video, my non-stress test. So that is what a nurse is going to probably be looking for initially. They want to see baby on the monitor. They want to see if you're contracting. They may touch your belly to see how strong those contractions are. Like I said in the previous video, those NSTs don't tell us how strong the contractions are. They just tell us how often and how frequent. So the nurse may palpate, and then basically we wanted to get an idea of what baby looks like. Okay, so that is the first step that most nurses are going to do. Something that might change that is if you are in active labor and you're bearing down and baby's going to come, we're probably going to do a vaginal exam first. Again, I can't speak to every nurse, but most nurses would do that, especially if they're afraid the baby may come out in the next 5 minutes. So if you're not in labor and you're not feeling pushy, they may put you on the monitor probably first. So you might get put on the monitor, you'll sit there, they'll have to get a history, they'll have to understand, they'll get your prenatal, they'll walk through the labs, they got to figure out what has been happening during your pregnancy, what's your history, how many weeks are you, what number baby is this for you, how quick were your other deliveries, were you a previous C-section, is the plan for this to be a vaginal birth or a repeat C-section? Again, just a huge history. So come, just knowing your info. Most of the time they'll get the prenatal from your from the office of your doctor, and they'll have that there. Okay, so they have you on the monitor, they've done that NST to see how baby's doing, and now they've gathered the history. So now they're going to move on to an assessment of you, of your person, basically. So they'll listen to you, they'll check your reflexes, different things like that. They're basically just getting a picture of where you're at. They'll ask you questions like, when did you eat last? Have you been having nausea or vomiting, constipation? Have you felt baby move today? Have you had any vaginal discharge? Those will be questions that they may ask. Things that can be pretty common. Now, with vaginal exams, it really depends on how many weeks you are or what your medical diagnosis is. If there has been something like placenta previa, if you've had lots of spotting, if there are different things that would indicate to not do a vaginal exam, the nurse will not and will have to get basically orders from the doctor. In order for the nurse to do anything, there has to be orders from the doctor. A lot of times if you're past 34 weeks and you're in active labor, the nurse will check you because it's part of their standing orders. So something that is just routine that they're able to do. It'll depend on your hospital. But if they do a vaginal exam, they'll be looking to see how far dilated you are, more or less. Effacement is well, I'll probably walk through a vaginal exam on another video because it's kind of detailed. But that's what they're looking for. They're going to get a whole report on you, and then they'll go out and call the doctor. By then, they should have a strip that shows what baby looks like, how often you're contracting. They'll be able to give a physical exam. They will have taken your vitals, like your blood pressure and your temperature, and then they'll be able to inform the doctor on what is happening currently. From there, the doctor is going to make the decision on to keep you, to send you home, to treat you, to keep you as outpatient, or to admit you. Kind of a goal, if you could say, from depending on how many weeks you are. So they have all those terms where it's like preterm, term, post-term. So it depends on your gestation. If you're early, the doctor probably won't want you to have the baby yet if we're able to stop the labor. If you're far along and you're contracting and you're about to have the baby, then that'll be a whole different scenario. So just keep in mind that those are kind of the things they're looking for. It can be a lengthy process. We're trying to figure out what's going on with you, and we're trying to communicate with the doctor via phone what's going on with you, and then they're making the decision on how we proceed. I would say the biggest thing in a triage is just inform your nurse about anything during this pregnancy that we need to know about. It's our first time meeting you. We're trying to read through the prenatal, and we're trying to get all the information we can to the doctor, and then they're going to make the decision there on out. So hopefully that makes you feel a little less overwhelmed. Triage is a place for you to go when you feel uneasy and something doesn't feel right. Triage is there for that. We always tell moms who might call in that if you feel like something's wrong, go in and see the triage. And if you're there for an hour or two and everything's okay, and that's great. We'd rather you come in and us make sure everything's okay than you stay at home and something, something go wrong that maybe you had an instinct about. You women know your bodies more than anyone else. So make sure you listen to it, stay hydrated and all that good stuff. But that's what triage will look like if you go into an ED or into a mother-baby triage. So feel free to post questions below, subscribe and like. Again, not a medical doctor, can't give medical advice, just want you to get a picture of what you might be walking into and feel educated on what the nurse is doing and why we're doing what we're doing.